What does a child with autism go through?
It's a neurodevelopmental disorder. First is lack of communication. It is the two-way verbal communication.
If you cannot communicate, then you cannot understand what that other person is saying. Now you don't understand intention. So if you don't understand intention, how can you trust people? When you were saying this, I suddenly got this really dark feeling of being trapped. वो पॉइंट से हम वो चाइल्ड को कैसे बाहर निकालना शुरू कर सकते हैं?
When it comes to parenthood, people don't seem to work to gain knowledge about it. Generally, at around 3 months age and all, we see social smile in the child. So the very important sign in children with autism, there is a lack of this social smile.
2 weeks ago, I had a patient, 5-year-old boy. The mother got him, and the mother was saying that 1 year ago they detected that he couldn't hear. Turns out that child had profound hearing loss from birth, but till the age of 4 years they didn't do anything. Between deafness and autism, both of it can look the same later, but is there a difference?
Denial phase is very common, and the more the parents are educated, the more denial you see in them. This is my experience. Because the first thing which comes into their mind is, why me? Why my child? Stop asking this question to yourself. Why me? If it is there, what I can do for my child?
In our series of Second Opinion, we have spoken to doctors before on autism. ऑटिज्म ऐसा एक बीमारी है जो बहुत सारे बच्चों को अफेक्ट करता है एंड इट रियली मेक्स लाइफ डिफिकल्ट, बट देयर आर सॉल्यूशंस. एंड टुडे आई हैव विथ मी मैडम मयूरी रामदासी. She is the founder of an organization called ARULA, and she focuses on helping autistic kids from all across the country, in fact all across the world. Today we are going to talk about what can be done in autism. Madam, thank you so much for joining this podcast.
Thank you, Dr. Siddharth, for inviting me to this podcast, and I'm really thankful to you.
हम शुरू करते हैं सीधा. What does a child with autism go through? When I see a child with autism, I always wonder that the way I am looking at the world and the way this child is looking at the world is very different. तो आपके experience में, can you talk about that? कि वो बच्चे के नज़र से what is different in autism?
See here, Dr. Siddharth, I remember a few lines which my mother used to recite and used to sing for me when I was a child. She used to sing, it's in my mother tongue, Marathi. The lines go through like that. देव जरी मज कधी भेटला, माग हवे ते माग म्हणाला, म्हणे न प्रभु रे माझे सारे, जीवन देई मम बाळाला. The simple meaning of these 4 lines are कि if in case, sometime, somewhere, if God comes in front of me and this Almighty asks me कि hey mother, tell me what do you want in your life? I'm here to give you whatever you wish for. Then that common mother, she always says कि I don't want anything for myself. It's in that instant of that mother. What she says कि give everything to my child, whatever he is wishing for, he is willing for, everything, just fulfill all his dreams. So I'm coming back to that point. See, this is something like every parents, they see this dream for their children. And the child is born, they become parents, and child grows. So in the developmental period, some period goes very fine, okay, it is not noticeable, but somewhere something goes wrong, and the child gets diagnosed as your baby is on autism spectrum. Okay, so here when I talk about autism spectrum, the simple definition is it's a neurodevelopmental disorder. Okay, it is characterized by, according to my experience, the most important characteristics which I feel which are there in autism are, first is lack of communication. Means the child is facing lack in communication. Now, when I say communication, it is the two-way verbal communication. So, what do we mean by two-way verbal communication? It is there is a speaker there is a listener. Whenever any conversation takes place, communication takes place, there is a speaker, there is a listener. These two people, they interchange their roles, and the conversation goes on, the communication is achieved. Two-way verbal communication. The child is lacking in this. That is the first point. Second part which I see, there is lack of socialization skills. As the name suggests, autism. Child likes to be within himself or herself. They have their own cocoon, they have their own world. They like to be in that. They are very comfortable with the fixed thing, with the fixed nature of environment all around. So lack of socialization skills means generally the child is around 2 years, 1.5, 2 years. The parents notice that the child is not mingling up with the people around him. He is not mixing up with the children of his age, or forget about some children in the ground or some new people or strangers. With the family also he is little withdrawn. With the family members also he is not mixing up or gelling up properly. The communication is hampered. And the third point, it's a byproduct of these two symptoms or characteristics. I always say that there is a presence of repetitive or negative behaviors.
Okay.
When there is lack of communication, when the child is not able to express himself or herself in words with emotions, then there is a presence of negative behaviors, which we call at sometimes they are self-harming, sometimes it harms others. And the examples of negative behaviors like screaming, yelling, and many others like the stimming, meltdowns, everything comes under this thing. So this is the way we are, the actual picture is presented. It varies from child to child, but in general this is the picture of autism which you get to see.
So the image that you are making is, सबसे पहले आता है communication problem. So now you and me are talking. So I'm saying something, your brain is listening, understanding, and then you will say something back, and my brain is listening and understanding and saying something. This interaction most people take for granted.
Absolutely.
बात तो होती है, इसमें क्या बड़ी बात है? But a child who is unable to do this, so much is built on top of this. If you cannot communicate, then you cannot understand what that other person is saying. Now you don't understand intention. So if you don't understand intention, how can you trust people? If you can't trust people, how can you work together with people? So अगर वो communication चला गया, then that other thing you said makes so much sense कि वो खुद की दुनिया में रहेंगे, क्योंकि वो बाहर जाते ही उनको समझ में नहीं आ रहा है कैसे बात करना है लोगों से. When you were saying this, I suddenly got this really dark feeling of being trapped almost. कि मुझे अचानक से ऐसा लगा कि what would the child be going through कि वो बाहर नहीं जा पा रहे. I suddenly feel that we should really get to the solution part of this conversation, क्योंकि ये बहुत ही difficult situation है वो बच्चे के लिए. क्या होता है उसके बाद? How does वो पॉइंट से हम वो चाइल्ड को कैसे बाहर निकालना शुरू कर सकते हैं?
First of all, acceptance is the very important key to success. Acceptance of the parents and knowledge and wisdom. Basically it comes with acceptance and then it follows knowledge and wisdom of the parents. Simply I tell, there are so many young moms watching this podcast, young dads watching this podcast. I always ask them one question, that see, you all are qualified, you all are so educated. So to gain that degree in your life or to pursue your career, you have done so much study. Because you have literally studied each and every part of your subject and you have come to this level that you have, taken the degree, you are pursuing your career or whatever. But when it comes to parenthood, it comes to motherhood, fatherhood, people don't seem to work to gain knowledge about it. A simple thing I tell for the mothers. When you are pregnant, what study do you do? What exactly the stages that you are going? And it doesn't require, it's not a rocket science. It doesn't require a lot of Google Baba's this thing also, information. There is some particular experts, you can say, the reading or knowledge, that is enough for you to gain that knowledge. So once you become a young mom, see, every child goes through different developmental stages. Those we are calling as something falls in this particular time, that is called as milestone
Yes.
in general.
Yes.
The milestones. Okay. Means every child goes through that milestone. There are motor milestones, there are speech milestones, cognitive milestones. All these are developmental milestones. Little vigilance about what my child is going through, what is he achieving. That is more than sufficient to make you realize that everything is falling in place. My child is developing well. Oh, something is not right. Let me just think about it.
Right.
So this kind of thing. So I don't want to talk about all the milestones and stages right now at this page. But when it comes to speech milestones, generally at around 3 months age and all, we see social smile in the child. So the very important sign in children with autism, there is a lack of this social smile. That is lack of that, because around 3-4 months of age, the child is not able to give that social smile or the cooing, giggling responses to the world, to the known voices that he is listening, hearing. So that lively response we are lacking. Why I am telling all these things to you? Because these are the things when Devahuti, as a mother, I have noticed that I will come to that journey later. But understanding the milestones are very around 8 to 10 months. My child is babbling. Is the babbling stage occurred? Ba 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 la 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 do 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 do. Kind of continuous babbling stage. It comes naturally.
Right.
It's a law of nature. It comes. Is it coming? My child is 1 year, around 1 year, 2 months, 3 months. Is the first meaningful word is coming?
Right.
Is he saying papa, mama, dudu, brr, something like that? Is he coming out? Or no? Something like that. My child is 1.5 years. इतना भी नहीं, मैं थोड़ा और आगे जाती हूँ, नहीं नोटिस किया. 1.5 years का है बच्चा. पप्पा किधर? मम्मा भुर, दुद्दू दो, नहीं चाहिए. Sort of 2-word phrases, simple phrases. Are they coming? Is my child expressing? And a more, this is a speech expressions or speech milestone. There are some listening milestones also.
Yes.
1.5 साल का बच्चा, if I am telling some story to him or narrating the event, a very small event. Oh, that day Papa came late and Papa was very hungry and then no one was there, and what happened? Arey, something like this, the event narrations and all. If I am talking to my child, is he giving that sustained eye contact to me? Is he listening to what I am saying?
Right.
All these things, simple things, Dr. Siddharth, that needs to be noticed by the parents. And many of the times what happens, sometimes I see it is not only the parents I want to, put the blame. It is not a blame game or something. It is just like making them aware. It's not only that, but in the senior people in the family,
Yes.
they also sometimes misguide.
Yes.
There are two types of grandparents, I always say. Some are very vigilant. Is he doing right things at right time or no? And there are some, अरे उसका डैडी भी बहुत लेट से बोलने लगा था, अरे वो 5 साल का हुआ तभी बात करने लगा, why are you taking tension? It is okay if it is not happening. These kind of false assurances the parents get.
Yeah.
And this is the way the things go wrong in the future. Now coming back to the listening.
Yeah.
The listening skills are very important to be built, because speech is a byproduct of good listening. I always say, a child who is a good listener eventually becomes a good speaker. This is a rule of thumb. So the approach, at the same time you said about solution, you are very keen to know about that. The approach should be based, when you are catering children who are on spectrum, the approach should be based on listening skills development. We have to make, because what is the root cause of all the issues that we face in autism? Lack of communication gap. No speech, no listening, and that is why all the fully blown symptoms you see.
Absolutely.
Work on the root cause. I always say it's a root cause analysis.
Yeah.
Work on listening skills of the child, you see better picture, rather the best picture.
Very recently, around 2 weeks ago, I had a patient, a 5-year-old boy. The mother got him. He was very naughty. And the mother was saying that 1 year ago they detected that he couldn't hear. And all her family members were saying that, very similar to what you said. The father was also speaking at 5 years of age. Why are you worried? Turns out that child had profound hearing loss from birth, but till the age of 4 years they didn't do anything. And at 4 years they put a hearing aid, and now even if the child is smart, he's getting 100 on 100 in maths, but his language is very poor, and so he is not able to cope with anything. So there are, my doubt is, between deafness and autism, both of it can look the same later, but is there a difference in your view of deafness and autism?
वेरी ब्यूटीफुल क्वेश्चन. मेनी टाइम्स कन्फ्यूजन हो जाता है कि डेफ है बच्चा, क्योंकि व्हाट हैपन्स, द वेरी इंपॉर्टेंट दैट सिम्टम दैट वी गेट वेरी विजिबल, दैट इज द चिल्ड्रन ऑन स्पेक्ट्रम, दे लैक इन रिस्पॉन्डिंग टू देयर नेम्स. मीन्स व्हेन यू कॉल आउट द नेम, then that time they don't respond immediately, or they lack in responding that. Again there is a poor eye contact also. There is a lot of hyperactivity also. So ये सब सिम्टम्स जब एक हो जाते हैं ना, तो वहाँ कन्फ्यूजन बन जाता है कि सुन तो रहा है क्या, बट यहाँ पर बहुत, आई ऑलवेज कॉल इट्स अ मिस्ट्री, बिकॉज व्हाट हैपन्स, the child is not responding to his name that is there, or the mama is talking, people are giving commands, he is not following the instructions and all. लेकिन उसकी he is sitting in the bedroom, उसके पसंद का एडवर्टाइज का सॉन्ग लगने दो टीवी पे, भाग के आएगा बच्चा. उसके पसंद का रिंगटोन बजने दो मोबाइल पे, भाग के आएगा. ये क्या है? दिस यू डोंट सी इन प्योरली सेंसरी न्यूरल हियरिंग लॉस, दैट इज द डेफनेस व्हाट वी कॉल. द चाइल्ड इज ऑल द टाइम नॉट रिस्पॉन्डिंग टू दिस. यहाँ पर कोई कौवा बीच में ही काव काव कर रहा है, he gets attracted and sees. This is the thing. But there is intermittent kind of response that the parents get. इसीलिए वो डिटेक्शन एंड एवरीथिंग becomes a mystery कि why my child is doing this way. If it's some nursery rhymes come or something like, he is very much responding. He says also all together. नर्सरी राइम्स बोलता है. इतना क्या, मेरा एक बच्चा है जो भगवद गीता का 15th अध्याय जो है, 15वां अध्याय, वो भी पढ़ता है, बोल कर बताता है. देन वाई, व्हाट अबाउट कम्युनिकेशन? सो देयर आर certain blockages, but again I tell, the more you dig into it, you see to it that अरे बहुत कुछ सीखना है अभी बच्चों से. These are gifted children. You have to work a lot. Right direction with right approach.
दिस इज़ अ कॉमन मिथ अराउंड ऑटिज़म, और ये शायद कई मूवीज़ ने भी शायद प्रोपगेट किया है कि ऑटिस्टिक बच्चे एक्चुअली, उनके पास एक अलग कोई सुपर पावर भी हो सकता है. जैसे अगर कोई ऑटिस्टिक है लेकिन वो मैथ्स में बहुत अच्छा है, या ऑटिस्टिक है लेकिन वो पेंटिंग में बहुत अच्छा है, इसका कोई कोरिलेशन आपने देखा है आपके एक्सपीरियंस में?
नहीं, आई एम टेलिंग यू वन थिंग वेरी क्लियरली कि they are really gifted children. They have their, and why only autistic? हर बच्चे में वो होता है.
Correct.
I will not put it in such a way that only autistic have this thing, and don't have that discrimination among the children. This is what the thing which you foster, that is going to give rise to the excellence in that particular subject or that task that the child is doing. Here I want to give you one example. A few years back, parents came to me, okay, with a child 6-year-old, and the child was non-verbal, means partially verbal, I will say. But they came and they sat in front of me and they started talking about. So I started taking the case history and everything of it. The father seemed to be very enthusiastic, okay, and I really liked it. The father said, you know ma'am, my child is brilliant, superbly gifted. Yes, can you explain? Then he said, you give him pieces, 400 pieces puzzles. He will sit for 3 hours all together at a stretch, but he will finish and he will show you that 400 pieces puzzle all together. He's such a brilliant child. And mother was also supporting, and lot of enthusiasm and happiness on their face. I really liked it. I said, very good, excellent. But now let me ask you one question. Like your child is 6 year old, and suppose if I give him, you are there with the child in front of a shop, a small, जैसे किराने की दुकान होती है ना, वहाँ पर आप खड़े हो लेकिन आप बाहर खड़े हो. You give 10 rupee note in your child's hand, and you say, go get your favorite chips from shop. Go inside, ask for it and get. It's not a mall that you select and you just give. You have to ask the vendor, I want this and all. So will your child be able to do that? This is one thing. Second question. Mama is there at home with him and mama tells, see, I'm going down 10 minutes. Sabzi wala aaya hai niche. I'll just take the vegetables and come. 10-15 minutes, just take care of home. And your younger brother is there, just take care of him. I'm just going for 10 minutes downstairs. And I'm coming back. Take care of the home and भाई को भी संभालना जरा.
Right.
Okay, मैं आती हूँ. Second thing, will be your child. He was having a younger sibling
Right.
also, 3-year-old. So will your child will do that?
Be able to do that.
Second thing. Third thing, mama is little ill. Mother is not feeling well. She's on medication, she's lying down and all. Will your child come again and again and will say, would you like to have water? Should I do something? Or he will take, I will not say take care. 6 साल का बच्चा care क्या लेगा? But that
Empathy.
instinct and empathy whether he's having, कि mama is not well or mama is telling I'm not well, don't disturb me, that he will not disturb. Or he will come and ask you want water or something. That he will do. And fourth thing, you are walking on the roads with your child. And it's a small road, not very crowded and traffic and everything. But on the opposite side, your friend comes, your friends. And he says, yeah, I have something to give you. He has a bag. And if you ask your child, just go there, cross the road, just take this thing from uncle and come back. Then will he be able to cross the road on his own? Looking right, looking left. He will be able to cross the road, then take the things and he will come back. So ये सब चीज़ें ये examples मैं आपको बता रही हूँ. This your child does. That time the father was speechless. He said कि we never thought. Then I said, verbal communication should be achieved or is achieved via self-dependence, and that is the key to success. The more you make your child self-dependent, self-sufficient, you see that he is getting connected with the world and the speech flows. Speech is not a learned task. Means, I say banana, you see, repeat banana. I say mango, you say mango. It doesn't happen. It should not happen like that. We don't want to make parrots. We don't want to create parrot speech in the child. We don't want to make them robots. We are creating, we want to create lively child who is talking, who is playing, who is arguing, who is fighting, who is lying at times. All those things we need to develop. So the question is I always say, now the ball is in your court, parents. What do you want? You want to create robots who will solve 100 pieces puzzles at a stretch, or whether you want a lively, developing, street smart child.
So a child who argues and lies is still better than a child who just simply does one task and nothing else.
Absolutely.
You're changing the way I'm looking at children now. Because actually, when I think about it, the ability to argue is a very high cognitive skill. The child needs to think about patterns, come up with counter arguments. So all of that is difficult for somebody who just does a jigsaw puzzle.
Absolutely.
When you tell a parent that maybe their child has autism, that word autism can bring a lot of fear. So I have seen parents reject it. कि नहीं ये हो नहीं सकता. ये थोड़ा लेट बोल रहा है लेकिन ये नहीं है. How do you deal with that? उनको कैसे आप समझाते हो?
Denial phase is very common, and the more the parents are educated, the more denial you see in them. This is my experience. It's not wrong to be at denial at first, because it's a very normal reaction, very robust reaction of the parents. Because the first thing which comes into their mind is, why me?
Yeah.
Why my child? Everything is so normal. Her side, means the mother's side, father's side, no such evidence, no such instances. But why me? And this is the thing, that why me question that stops you from progressing further. First of all, I always tell this to all the parents. First, stop asking this question to yourself. Why me? If it is there, what I can do for my child? Cursing or talking, thinking about or running after different people, different professionals. See, you are the parent. Definitely, it becomes difficult for us to believe that or to accept that something can go wrong. But when there are some visible evidences in front of you, there are certain symptoms that are. How long would you like to be in this phase of denial?
Right.
At one point, you have to overcome. See, I tell you one thing, ये denial भी क्यों होता है? You suppose a child, if you just as an example, if you take a child who is physically challenged, or there are certain things, their symptoms, their appearance, their everything is so visible that the acceptance becomes easy for them. But when it comes to children on spectrum, absolutely things are fine. Most of the cases, definitely there are going to be some prenatal, postnatal, or some heredity, genetic base, and everything is there. But in general, what happens? That child is developing well. Motor milestones are achieved. Everything is fine. And then suddenly, the thing comes. Or sometimes parents notice regression in the milestones around 1.5, 2 years.
Which must be so difficult.
It is very difficult. We can understand. See, one thing I tell you, Dr. Siddharth, just don't consider a global speech language therapist is talking to the parents at this point of time, talking to you. I'm talking to you more as a proud mother of a daughter who is 17-year-old right now and beautifully developing. She's an excellent orator, very good narrator, excellent debater, eminent speaker, good artist, scored 89% in her board's exam, and now pursuing her career in literature, psychology, all together, and art also, all together. So this is my advice to the parents. See, why am I describing all these things about Devahuti? Because Devahuti, I see Devahuti in every child who is on spectrum. But then
your daughter was on the spectrum.
She is on the spectrum.
She is on the spectrum.
Okay, that is the thing. She is. इसलिए पहले जो आप अपने एक वर्ड यूज़ किया डॉक्टर सिद्धार्थ की, ये बीमारी, जैसे अभी हिंदी में ठीक है बताना है तो हमें ये वर्ड्स नहीं मिलते हैं.
Correct.
लेकिन ये बीमारी नहीं है. फर्स्ट ऑफ ऑल इट्स एन से डिसऑर्डर भी से क्यों बोला जाता है? क्योंकि जहाँ अर्ली अवेयरनेस आइडेंटिफिकेशन नहीं है, अर्ली साइंस आर नॉट पिक्ड अप, यू डोंट वर्क इन द राइट डायरेक्शन विद द राइट अप्रोच, देन द symptoms are fully blown. They come into the devastating traits you see in autism. अगर इस पे ही काम करें, रूट कॉज जैसे एनालिसिस, आई ऑलवेज से वर्क ऑन लिसनिंग स्किल्स डेवलपमेंट, यू विल नॉट सी दिस all these symptoms, all these traits, and then it will no longer remain as a disorder. So first of all, I want to tell all the parents, it is not a disorder.
Beautiful.
Consider it as a condition. That is one thing. But more than that, I will say, उसे कंडीशन भी मत बोलो, just treat it as an extended behavior of your child. See, we all are humans, डॉक्टर सिद्धार्थ. मैं कहती हूँ डॉक्टर सिद्धार्थ ना बहुत चिड़कू है, बहुत जल्दी चिढ़ जाते हैं, is very, and then this another that my fellow, this friend is very choosy about the things and what is there around. She is the one, she doesn't get adjusted with the people only.
Disorder थोड़ी ना है.
These are behaviors. These all are, and we all are with these behaviors.
Right.
But in these children, when you don't give them their right from the birth or right from that age, early identification. जैसे मैंने कहा 4-5, Devahuti was 5 months old when I noticed. It was Almighty's grace that I was belonging to this field as a speech language therapist.
Right.
Plus a mother for the second time. So I was very vigilant about her development. And then at around 5 months I noticed my child is more of mute. She's mute. She's not cooing. And what I meant to say, when you diagnose, when you realize that your child is on spectrum at the very early age, or there are certain high risk behaviors are there, then it doesn't remain as a disorder. It's just like an extended condition, extended behavior of your child, and you can easily conquer all the devastating traits of autism. I'm really telling you.
Got it.
My daughter, अभी भी मुझे उसको कॉलेज, अभी आज सुबह यहाँ आना था मुझे, मैं मोस्ट ऑफ माई आवर वर्क इज़ वर्क फ्रॉम होम होता है मेरा, आना था, तो शी थोड़ा सोशल कम्युनिकेशन इशू से अभी भी बहुत जल्दी फ्रेंड्स सस्टेन नहीं कर पाती है, तो थोड़ा सा कॉलेज जाना, अभी कॉलेज नया नया शुरू हुआ, शी इज़ इन जेवियर्स फॉर आर्ट्स, अभी भी शी थोड़ा स्ट्रगल होता है उसका, सुबह उठने का, आई डोंट वांट टू गो टू कॉलेज, व्हाई नॉट, एंड पुशिंग हर दैट एवरी डे, that fight is there. Fight means you have to go to the college, and sometimes there is a bad day. See, there are going to be good days, bad days in the child's life. When there are bad days, let her live her moment na, at that point. क्यों पीछे पड़े हो तभी? ऐसा थोड़ा सा हमें सीखना है. So parenthood is most important. Children are easy to handle. Parents are difficult.
My God. So as a speech therapist who manages autistic kids, do you find your greater challenge to be the parents?
Definitely. People that day, one day what happened when we had a conference, and I had gone to the conference, and after the conference we had a roundtable meeting, and in that meeting one very you can say wise professional from our field, she said, you cannot treat all the children all together because children are different, each child is different. Then I said, no madam, excuse me, children are same, whether it's a 2-year-old child or it's a 20-year-old child, children are same, parents are different. Every mother is different than the other mother. You make them realize this, you make them realize their potential, you counsel them, you educate them, rather than counseling, I like to use this word, you educate them, you give their knowledge, wisdom, their motivation, enthusiasm, work on that.
Yeah.
You see that when the mothers become same, children process like that.
This is a theme that keeps repeating when you are talking. I've noticed that your stress is on home, parents observing children, and mothers. So what is the importance of parents' home in the treatment of somebody with autism, as opposed to other diseases where the doctor will take over the treatment, you get admitted in a hospital, they will manage, and then the patient will come back home all good. But I'm thinking autism seems very different. तो काफ़ी home based therapies होता है, तो what is that? Why is home so important?
Here, Dr. Siddharth, we need to understand one thing, कि अभी current notion with respect to therapeutics क्या चल रहा है, that also we need to work, we have to think up, see that, we have to talk about that, and then why home and why mothers, that answer will be more clearer to you.
Okay.
So here I want to ask you one question, Dr. Siddharth. Suppose there are 2 babies born at the same time. Okay, one baby is born blind since birth, she cannot see, he cannot see. Another baby is born deaf, okay, cannot hear. So when both of them will grow, then eventually which one of them will start talking like you and me?
The blind one.
Absolutely right.
Yeah.
It's a common. We see so many blind people around us. They are so capable. They are so good communicating and everything. So this example, a simple example, shows us what? In order to develop very good speech, language, and two-way verbal communication, the visual sense plays a negligible role. The most important sense is the sense of audition. Rather, specifically I will say sense of listening. When I say listening, it is the hearing plus understanding and responding, that is listening.
Yeah.
Okay, this is my first statement.
In fact, there was a show called India's Got Latent, and वहाँ पे I think more than 1 crore people were watching that show on YouTube, and a couple of people who were blind came on that show and they performed stand-up comedy and they killed it. They were so good. Like the entire nation loved them. And the fact that even though they were blind, they were able to do that. Write jokes, come up on stage, perform, make an entire country laugh is so inspiring. But I'm thinking whether a child who was born deaf, would they be able to do that? Would they be able to have the ability to write jokes and perform like that? It seems so much more difficult.
Absolutely. So you got it. This is our first statement or
Yeah.
pointer. You have to keep it in mind
Yes.
that in order to develop good speech, language, and two-way verbal communication, the listening sense plays immensely important role. Rather, this is the sense which is most important. This is first. Now let us talk about our children who are on spectrum.
Right.
Okay, who are on autism spectrum. Now these children, they are innately very good visual seekers. Now why? Because they lack in communication, verbal communication, express themselves.
Right.
They develop that visual sense is a dominant sense. It takes over and they become very much visual seeker. Means the symptoms that you see, they are not they are restless. They don't sit at one position for a quite long time. They have less sitting tolerance. They have attention deficits. They keep on, their eye contacts are flickering. They constantly try to get in touch with the world through their visual sense. For here now, I just want to give an example to all the parents to understand in more with the clarity.
Right.
Suppose I am a Maharashtrian lady, okay, Marathi lady. Suppose if I go to a very native place in Kerala, you are from Kerala,
Yes, yes.
okay.
पण आपण मराठीमध्ये करू शकतो. पॉडकास्ट करायचं.
ऐकून गेला तुला आता येतं रे, पण आता कसं गोष्ट आहे गंमत ऐक.
Oh, it's so nice.
तर जर if I go to Kerala, very remote place in Kerala, and I go to one vegetable vendor over there. And I want to purchase vegetables. See, I don't understand his language.
Right.
He doesn't understand my speech.
Correct.
So what happens? There is a emergence of communication gap. There is a communication gap.
Yes.
In that sense, what happens? Naturally, within me, my visual sense becomes dominant, and I start reading the body language of that person, his facial expressions, his gestures. I try to bridge that communication gap.
Yes.
You are exactly understanding?
Yes.
The same thing my child does, but in its own way. Means what? He's constantly want to get connected with the world. There are certain blockages in the speech, understanding plus expression and all those things. But he's constantly, trying to bridge that gap and trying to get connected with the world. And in order to achieve that, he develops innate visual seeking within him.
More hand gestures, more pointing at things.
It's not he doesn't point at all. Rather, see, I'm telling you, I'm not able to get connected with the world. I will keep on touching the table. I will keep on touching the objects around me.
Right.
Then there is stimming behavior. There are, you can say, lack of sustained eye contact that we see. Flickering things and all. So this happens constantly with my child. Okay? Now here, this is the second statement. First is listening sense is very important to develop speech. Second, our children are innately very good visual seekers. Now let us talk about the conventional therapies which are there right now in the field of autism.
Okay.
Once your child is diagnosed or maybe seen as at high risk of having on spectrum, then he is recommended multiple therapies like occupational therapy, speech therapy, behavioral therapy, ABA. And I come across so many mothers all around the globe. Every nation has got their own approach.
Right.
Different approaches they are there. But I club them all together under one roof and I call them as conventional therapies for autism. Okay? So what these experts, or other school of thought, I will say, these experts thought the child is already a very good visual seeker. So let us derive an approach which is very much based on visual learning. Okay? Let us utilize his potential to such an extent that will develop him. And then all these therapies came in picture.
Right.
You see a therapy session, a common therapy session, you take a speech therapy session or occupational therapy session and other thing. You see them, it is carried out in an unnatural environment first. It's a clinical room or something, unnatural environment. Secondly, lot of tabletop activities are used. Means lot of extensive use of flashcards. To show, even teach banana or mango, you are showing the flashcard to the child. For sequencing, for discriminating activities and everything you are showing the flashcard. Rather to understand who is mom and who is dad also, you are showing the photos of their mother and father. You are using the flashcards. For jumping, these activities, for jumping, then eating, sleeping, these kind of words, actions we have to teach with the flashcard. So there is a extensive use of flashcards, that bombardment is done on the child. Lot of sequencing, lot of tabletop activities with puzzle solving, then tracking, then block buildings, and any sequencing and all these activities, it becomes the core of these therapies. To engage the child or to increase its sitting tolerance or everything for a longer period. And these therapies are carried out for half an hour to 1 hour constantly. So what happens as a result? The child is a good visual seeker. Right. He learns also through visual learning. Right. But what happens as a result? The poor sense, which is completely solely responsible for the beautiful development of speech, that is deprived, that gets deprived. It doesn't get the opportunities only to flourish. बड़ा भाई है ना visual sense, वो सब काम कर रहा है, छोटा भाई ऐसे ही बैठा है, क्योंकि वो dominant है, वो ही take over करेगा. और जितना visuals के ऊपर work करोगे, उतना listening sense will वो दूर जाता जाएगा. And here, when now again, birth of ARULA. Should we talk it right?
Please, yes.
Okay. So when I noticed that my child is something different, and when around 8, 9 months, 10 months, so it was very much clear that thoda alag hai karke, the things are getting delayed in her case. Then I was not convinced with this, because as a speech therapist I have seen the limited outcomes which happens with these conventional therapies in children with autism. Right. Rather, as a student, it used to be a nightmare for us to handle a child with autism. So many, secondary behaviors, these negative behaviors and everything handling, because there was no fabulous, or I will say miraculous things or happenings, results are occurring. Right. So I was not convinced with that. Then my thought process started working on these levels. If speech is the main concern in autism, and the root cause is lack of listening skills, then we have to work on listening skills. And in that case, it makes me proud to say that my mentor, my guru, we call him as Aniruddha Bapu by lovingly, with love. He's a Dr. Aniruddha Dhairyadhar Joshi and his wife Dr. Nanda Aniruddha Joshi. Yeah. This couple, they guided me in a very right direction. They say that if you want to develop good speech, communication, work on listening skills development. Make your child a good listener. Then the study began. And while growing Devahuti, while working on Devahuti, ARULA started taking its shape in a proper way. Because there are two aspects which we have to keep it in mind. Listening skills development, and second aspect is evoking urge of communication within the child. See, I always say, Dr. Siddharth, we come across so many people around us, our relatives, friends, colleagues. With some people we get bonded very quickly. We feel like talking to them, we feel like meeting them, we feel like getting connected. With some people we are absolutely not interested. What is that? The psychological aspect says that this is the innate urge within you towards that particular fellow. And this is where our children are lacking. A mother, this is the experience of every mother whose child is on spectrum. वो 10 बार बच्चे से बात करने जाती है, अरे ये कर, अरे वो कर, अरे यहाँ देख, do this, do that, but there is no urge of getting communicated in the child, and we have to develop that in the child. And here, two statements I make very clearly. If you want to achieve these two things, listening skills development and urge of communication, home is the best therapy center and mother is the best therapist for her child. ये अर्ज जो है कम्युनिकेशन की, बच्चा कब डेवलप करेगा? जब उसको उसकी चॉइस की थेरेपिस्ट मिलेगी तभी. करेक्ट. उसके पसंद की, जो बहुत बॉन्डेड है उस थेरेपिस्ट से. So I always tell this to mothers. Mothers, you have two weapons in your hand. Your voice and your touch, which cannot be replaced by the most expensive and most expert therapist in the world. But what is lacking? What are the limitations? That you don't have the knowledge and the wisdom and the secret recipe to nurture your child. So I am sitting here to give that to you. This is how the ARULA's birth take place, and ARULA went on expanding. As Devahuti progressed, it was like an everyday, my child used to mesmerize me. And that way, the very structured, I will say, a very structured program took place. It came in picture. And now, as I say, it's not only a therapy or not only a something technique that you are following. ARULA itself, within itself, is an approach with the best lifestyle modifications for the children who are autistic.
What is that treatment protocol? So suppose if there is a child with autism who comes to me and I refer to you, what can I tell them to expect?
Okay. So the first thing I would like to say, ARULA is a completely online approach. It's a completely online approach. Means again I say, halfway truth online means it's an online training, online knowledge giving and everything to the mother. But as the name suggests, as I said, the child is getting therapy from his own mother, his best therapist. So it becomes offline therapy for the child. Okay.
Right.
So once you feel that ARULA, I want to get enrolled or I want to study about ARULA, definitely there is a website, ARULA for Autism.
Right.
You can go on to that.
Yeah, I went on that as well.
Yeah. So there are the things. Now, you want to understand the technical execution
Yes.
of ARULA?
Very briefly, yes.
Okay. So the stages that goes through. First, once you put your inquiry on website or in some through other media like Insta or this thing, then our expert ARULA guides, they come in picture to get connected with you. Means who are these guys? They are all psychologists. Okay. Not as some random people calling you and telling you. So they will explain you about the things. The first stage is the initial assessment conduction. That works on. What is this initial assessment or ARULA's initial assessment? This is based on 18 developmental parameters. ARULA's very own 18 developmental parameters.
Okay.
Here it is completely based on parental perception. Definitely, as the name suggests, mothers are the therapists, so she is the best judge of her child's condition. She may not know the names of therapeutic parameters or some clinical definitions, but she exactly knows where my child is standing, what he can do and with what he is struggling. So it is completely carried out on parental perception, that here on every parameter, on each parameter, mother or the father, they give ratings to their child on 1 on 10 scale. This is the way the first stage of initial assessment is conducted. Then there is a live webinar that they have to attend after the initial assessment conduction with me. Once they start their journey with ARULA, after that the enrollment takes place. Once they start their journey with ARULA, as I say, it's an approach made by a mother for a mother. A senior mother understands what a junior mother goes through. And it is made in such a way that the entire knowledge, the wisdom, it is given in the form of portal on the website. Means once the mother starts her journey with ARULA, she get access to the portal which has got more than 250 videos as of now, and they are counting, increasing. Some of them are all video demonstration. All of them are the video demonstrations of mine. Some of them are video demonstrated modules. Some are video demonstrated techniques. Some are video VD activities. ARULA's very own concepts in the form of Zoom sessions. Okay. So these are an ongoing doubt solving sessions.
All of them targeted towards the mother.
Yes.
The child is not supposed to watch any of this.
Nothing. Absolutely not. Whether my youngest child is 1 year 2 months. As of now, and the eldest is 27-year-old.
Oh wow.
So you get the range and diversity in the children. So the portal is same for both of them. But now the important thing comes. Giving access to the portal is not enough. Then I will be appointing an entity called as Senior ARULA Care Therapist for them.
Okay.
Now, who is this entity? With her qualification as masters in either neuropsychology or clinical psychology,
Okay.
and trained under ARULA approach, the vigilance, guidance for a couple of years consistently, then she's
Listening based
designated
therapy.
approach, and then
Right.
she's designated as senior ARULA care therapist. A mother gets access to reach out to her ACT, that is ARULA care therapist, throughout the working days, throughout the working hours. Means suppose mother is watching a concept, okay, she's grasping that knowledge and she's implementing it on the child. Definitely success is bound to come, but at the same time difficulties and challenges also will come.
Of course, yeah.
Then she gets access to approach to her ACT, and the things are guided accordingly throughout the year.
Right.
Every month the MAR is conducted. MAR is monthly achievement report. The mother gives the rating again every month to her child. My child was on listening skills, he was on 3.
Yeah.
Now today this month he is 4 or 4.5.
Got it.
She goes on assessing the things. Okay,
Got it.
that is the way. And this goes on for completely for 1 year long structured
Okay.
program.
Okay.
What we expect generally, how will I know, okay, how my mother is working? We call them as ARULA super mom, we call
Yeah.
her. So how my ARULA super mom is working.
Right.
So I need 4 to 5 videos per week from her end that will be assessed by the
Okay.
that will be assessed by me. They
Understood.
go under my vigilance, and the ACTs give a elaborated video review on that. Rather good this thing also. The voice messages also goes
Got it.
through.
Got
See, simple thing, Dr. Siddharth, understand. I want to make the child a good listener. So the speech input that the child is getting throughout the day, throughout the year by the therapist, that has to be curated well, that has to be shaped well. So what to talk, when to talk, how to talk and how much to talk, that training mother constantly, ongoingly gets from the team ARULA.
Lovely. Can I ask about physical therapy? Because language is not just in the form of words, language is also in the form of movement. So, like you said about sign language, I'm observing you behave in a certain way and I will behave in a certain way. That is also language. So, have you found use? I know that you are a language therapist and a speech therapist, but have you also found use of physical movement, exercises in autism patients?
Definitely. I'm telling you, this development of motor skills,
Yeah.
gross motor skills, fine motor skills, very, very important.
Right.
But as I say, home is the best therapy center when I say. So every corner of the home is utilized. And the heart of workshop is going to be my kitchen. In the kitchen, especially the Indian kitchens, I always say to all my global mothers also, कि whenever you go anywhere in the world, Indian kitchens are the richest kitchens. Why they are richest? Because so many processes, they automatically take place.
Right.
We are not very instant.
Right.
We take time to, the things process. So 5 senses, they are worked best in kitchen. All the 5 senses.
Right.
Like olfactory, you say, your smell, you say, touch, you say, hearing, listening, you say, then
Seeing, smelling,
seeing, smelling, even taste.
Tasting,
Okay,
of
that is
course.
the last. Everything is worked so well in the kitchen.
Yeah.
So I always say कि when mother starts working in the kitchen with the children, that always I say कि the child becomes a PA to mama.
Wow.
Always. That is the relation and equation is built.
Beautiful.
Personal assistant. It's for everything she is involving him.
Beautiful.
And there are my children who have started making idlis and dosas also at home, and now they are demanding, I want it this way, I want it that way, spice is less, I want more spicy, something like that. What I mean to say, कि our home structure, the Indian, it's a heritage, the cultural and everything.
Right.
The spirituality also comes into that. That structure is so strong. Why you need to take your child somewhere out? Because everything is there. And child at home, he is always at its most comfortable zone.
Yeah.
जहाँ पर एडजस्टमेंट का टेंशन नहीं रहता है ना डॉक्टर सिद्धार्थ, कि सिचुएशन से और एनवायरनमेंट से, पीपल से मुझे एडजस्ट नहीं करना है, वहाँ पर बेस्ट परफॉर्मेंस मिलता है. See how comfortable I am today with you. I don't have to adjust. I am feeling so comfortable with talking to you. I am feeling okay. I am talking. I can go on for hours
Yes.
with you.
Yes.
Okay,
Yes.
something like that. So
Lovely.
here we need to understand Okay.
I was reading a study on how children who are made to do household chores perform much better in life in all other activities. And over the last 20 years, ये थोड़ा सा problem हो रहा था because parents, especially in the cities, used to think कि how can we make the child do housework? ये तो गलत है. Whereas I think in the generation till before mine, and a little bit for me also. I remember when I used to go to Kerala, my grandmom would make me clean the room, even well से पानी निकालना, वो सब मेरा काम था when I would go to Kerala. So now I think of how those activities were very useful. They make you feel part of the family. They make you feel useful. They make you feel responsible like a grown up. So children should be made to do household chores.
Exactly. And I tell you, only household it's not only that. Outdoor activities also. It's only play is also one important thing.
Right.
People ask me, mother, you are talk about mothers and all. What is the role of father? I always say, taking care of the mother is the role of father. This is one thing. You take her mental health, her social health, her spiritual health.
Right.
You take care of her, you love her. She is potential enough to do everything with the child. Okay? This is one thing. But as a father, वो जो मस्ती रहती है ना, बच्चों को बाहर लेकर जाके खेलने की, घर में मस्ती करने की, physical fights and all, that a father should give it to the children,
Yes.
especially boys.
Yes.
Okay, that is there. A mother they don't like. सब वो clinging ज़्यादा नहीं अच्छा लगता है हमको. तो वो father का role है कि वो दो. And as I say, outdoor activities, simple thing. I give an example कि all these my mothers who are abroad, okay, तो वहाँ पर ऐसा ना ठेले नहीं लगते हैं कि where they will go and purchase. And I keep on talking about all those things.
Yeah.
So few of them have taken decision to come back to India
Yeah.
for their child's development. क्योंकि super malls and markets में you don't get that opportunity to sit stand in front of the vendor. ये छोटा ही है, ये बड़ा ही है, इसको इतना महंगा क्यों दिया? Reduce the bargain करने का, वो जो झगड़ा करने का, वो opportunity नहीं मिलता है. और ये बहुत important है. Whether it's an indoor activity or outdoor, but in Indian situations and all, full of opportunities.
You know, when you say this, I just realized that the Western world, and in fact technology as a whole, is making us move away from communication.
Definitely.
जितना कम लोगों से बात कर सकते हैं उतना अच्छा.
I remember one thing. हमारे my दादी and all, everything like जब बात करने का, see our daddies and all, okay,
Right.
मेरे generation के, they used to have so much time to talk.
Yes.
Means even this normal speech used to be full of intonations.
Yes.
क्या हुआ, कैसे हुआ, अरे अभी इतना टाइम है आपके को?
नहीं.
We are
काम
come
की
to
बात.
काम की बात भी जाने दो, अभी we have come to emojis, okay? And Gen Z now Gen Z have their own different dictionary.
Correct.
What I mean to say, it is apart from the laughter and this part, okay, it's very important to realize that exactly when we want to nurture a child who is already a neurodivergent kid, these opportunities they need to be given to the child because they work on many grounds. First of all, problem solving. Day-to-day life opportunities give them problem solving.
Correct.
Then observation, alertness towards the surrounding,
Yes.
and most importantly decision making.
Yes.
For every age, 3 साल का बच्चा भी डिसीजन लेने के लिए होता है, उसके लेवल के डिसीजंस वो वहाँ लेता है.
Correct.
So what I mean to say, decision making is a very important aspect. We have to inculcate that in the child.
I was remembering this scene in childhood. मैं केरला जाता हूँ तो my grandmom's 4 brothers, 3 sisters, उनके बच्चे और उनके बच्चे, so all of my cousins, हम सब बैठे हमारे ancestral घर में, ठीक है, केरला में, इरनालकोड़ा में. It's a small town near Thrissur. And some 14-15 people, and people are talking, everybody is laughing, joking, and somebody will say something which has a little bit of gossip. But ऐसा overtly नहीं बोलते, थोड़ा सा एंगल में, लेकिन लोगों को समझ में आता है. कोई एड्रेस नहीं करता, लेकिन और कोई दूसरी एक आंटी कुछ ऐसे अलग से कुछ बोल देती है, और दूसरी एक आंटी कुछ वो सुन के और कुछ हटके से थोड़ा बोल देती है, एंड सबको समझ में आता है कि उन्होंने क्या बोला, एंड एवरीबडी लाफ्स. एंड वी यूज्ड टू टेक दिस फॉर ग्रांटेड कि हाँ फैमिली में ऐसा थोड़ा सा सम सार्केज्म, सम डबल मीनिंग वो तो होता है. नाउ व्हेन आई थिंक अबाउट इट, व्हेन you grow up in that kind of atmosphere, hearing different voices, डिफरेंट इंटोनेशन, जैसे आपने बताया ना कि थोड़ा अच्छा ऐसा किया, वो कहने का तरीके में कितना कुछ मीनिंग हम एक्सचेंज करते हैं. So children growing up in that kind of household will be exposed to so much more compared to nuclear family in Bombay. Mom, dad both working. Child goes to kindergarten, comes back. पता नहीं कितने बच्चों से बात करता है. But that is it. So much lesser language exposure. तो what is the, आपके हिसाब से जैसे बड़ा फैमिली का जो एक्सपोजर होता है उससे कितना फ़र्क पड़ता है बच्चे के डेवलपमेंट में?
डेफिनेटली जॉइंट फैमिली, बिग फैमिली, इसके प्रोस ज़्यादा है देन दैट ऑफ द कॉन्स. ओके, दैट इज़ रियली वेल, बट प्रैक्टिकलिटी में देखा जाए तो इट इज़ नॉट पॉसिबल फॉर वर्क per se, for the individual, you can say, freedom. They want privacy, the new couples and all, due to their you can say goals in life or with respect to careers, they move out and they settle down somewhere. See, my question is, see, always it is the fact that definitely family dynamics or the big family or the people in the family, the more the child is exposed to, definitely it is going to have a better you can say impact on child's development. लेकिन जहाँ ये नहीं होता है, आजकल तो ऐसा है कि मॉम डैड एंड वन चाइल्ड, उसमें भी बच्चा न्यूरो डाइवर्जेंट है, ऑटिज्म स्पेक्ट्रम पे है, तो एक ही बच्चा काफ़ी है, उसको ही नर्चर करना. इट इज़ अ टास्क फॉर द मदर, टास्क फॉर द पेरेंट, इट्स अ डिफिकल्ट थिंग फॉर देम. सो लेकिन उसमें भी Arula never says that you can't do this. I always say charity begins at home. So any developmental thing, okay, the program is structured in one way. The mother, the father and the child, three of them, they make the things happen in such a way that जिसके impacts, maybe speech outcomes, listening outcomes, social skills outcomes, you start seeing outside the world. But very important here is thing, family bonding is very essential. It is very immensely important. Means happier the mother, happier the child,
right,
and great productivity. And this is the equation one has to understand, where the mother, the father, they have to do manipulations and there is no transparency, clarity and purity of things. वहाँ पर चीज़ें डिफ़िकल्ट हो जाती हैं. जहाँ पर एडजस्टमेंट्स एंड डूइंग समथिंग फॉर द चाइल्ड, दे बोथ ऑफ देम, मदर एंड फादर, दे यूनाइट टुगेदर एंड दे थिंक, दे डिसाइड, आई वॉन्ट टू वर्क विद द चाइल्ड, वी वॉन्ट टू वर्क, वी हैव टू नर्चर, देयर प्रोडक्टिविटी इज मच बेटर. But unfortunately this is not the scene. I come across so many mothers, so many fathers all around the world. Lot of problems, Dr. Siddharth, that I mean, there is no need to even, I don't want to even mention those things over here. This is not the right, place. But as I say, कुछ नहीं है तो कुछ तो है. ये डेवलप करना बहुत ज़रूरी है. Always negativity. See, immensely important is negativity, to overcome that negativity in the family and being very positive towards the thing. And here, my message to all the parents whose children are on spectrum, they are developing, they are neurodivergent. As a mother, as a father whose child is on spectrum, we don't want preachings, counseling sessions or lectures on positive thinking or motivation building and other things. See, the moment I start seeing my child is developing day by day, little improvements are occurring day by day, that serves as a great motivation for me, and this is the motivation which lasts for longer. And that is the only thing that I want to tell to all the parents. Positive thinking is not something to be read and to be attended the lectures. You start working with the child in the right direction with the right approach, you see that yes, my child is mesmerizing me every day. Okay,
lovely. This is such a good note to end this conversation on. Madam, thank you so much for coming. Autism is a topic that I have been trying to understand more and more about, because honestly, even as a doctor, we were not taught that much about autism. But I feel very important to have more such conversations on the public platform. So thank you.
Thank you so much, Dr. Siddharth, for giving me this platform to express myself.
Pleasure to have you. All right. If you enjoyed this conversation and if you have any questions about autism, about children, and the modern world, put it down in the comments below. I am sure Madam will be back as a guest in the future. I will see you all soon. Bye, everyone.